Fragmin Syringe, also known as Dalteparin, is a medication used to treat and prevent harmful blood clots. This helps reduce the risk of a stroke or heart attack. Fragmin Syringe works by lowering the activity of clotting proteins in the blood, keeping the blood flowing smoothly. It is commonly used for conditions such as certain types of surgeries, long periods of immobility, certain types of heart attack, and unstable angina. In some cases, Fragmin Syringe may be used in combination with other blood thinners. It may also be used to treat and prevent clots from coming back in patients with cancer. It is important to follow the recommended daily dosage and take Fragmin Syringe at the optimal timing as advised by your healthcare provider. Before you start using Fragmin Syringe, it's important to read the patient information leaflet from your pharmacist. This medication is given by injection under the skin as directed by your doctor, usually once or twice daily. The dosage and length of treatment will be based on your medical condition and how you respond to the treatment. Your doctor may also consider your weight when determining the dosage for some conditions. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional and the product package. You should be lying down or sitting when you inject yourself, and always check the product visually for particles or discoloration before using it. Before injecting each dose, make sure to clean the injection site with rubbing alcohol and change the injection site each time to lessen injury under the skin. It's also important to learn how to store and discard medical supplies safely. If you are using Fragmin Syringe to prevent blood clots due to surgery, your doctor may direct you to start using this medication before or after surgery and continue for several days. It's important to follow your doctor's directions closely in this case. In order to get the most benefit from Fragmin Syringe, use it regularly at the same times each day. Remember to not mix this medication with any other medication in the same syringe, and to not rub the injection site after a shot to minimize bruising. Some common side effects of Fragmin Syringe include irritation, bruising, and pain at the injection site. If these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Fragmin Syringe can cause bleeding if it affects your blood clotting proteins too much. Contact your doctor immediately if you experience any serious signs of bleeding, such as unusual pain, swelling, or discomfort, prolonged bleeding, easy bruising, dark urine, black stools, severe headache, confusion, vision changes, dizziness, fainting, seizures, weakness, or numbness. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not listed here, contact your doctor or pharmacist. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you're using Fragmin Syringe, it's important to be aware that there is a risk of bleeding near the spinal cord after certain spinal procedures. This can lead to long-lasting paralysis or even permanent paralysis. Before any spinal procedure, be sure to talk to your doctor about the benefits and risks of using Fragmin Syringe. Your doctor may instruct you to stop taking this medication for a period of time before and after the procedure, so it's important to carefully follow your doctor's directions. The risk of bleeding may be higher if you have a deformed spine, or if you have had spinal procedures or surgery before, such as epidural catheter placement or difficult epidural or spinal puncture. It may also be higher if you are taking other drugs that can cause bleeding or bruising, such as antiplatelet drugs, blood thinners, or nonsteroidal anti-inflammatory drugs, NSAIDs. If you experience symptoms such as back pain, leg numbness, tingling, weakness, or loss of control of the bowels or bladder, it's important to contact your doctor right away. Before using Fragmin Syringe, it's important to let your doctor know if you are allergic to dalteparin, heparins, pork products, or any other allergies. This medication may also contain inactive ingredients that can cause allergic reactions, so be sure to talk to your pharmacist for more details. Before starting Fragmin Syringe, inform your doctor about your medical history, especially if you have any of the following: serious active bleeding, artificial heart valves, bleeding or blood disorders, certain eye problems, high blood pressure, infection of the heart, kidney disease, liver disease, low platelet counts after previous heparin treatment, certain stomach or intestinal problems, stroke, recent spinal procedures, spine problems, or recent eye, brain, or spinal cord surgery. While taking Fragmin Syringe, it's best to limit alcohol intake to reduce the risk of stomach bleeding. If you are planning to have surgery, make sure to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. To lower the chance of getting cut, bruised, or injured, be cautious with sharp objects like razors and nail cutters, and avoid activities such as contact sports. Older adults may be more sensitive to the side effects of this drug, especially bleeding. If you are pregnant, Fragmin Syringe should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using Fragmin Syringe. It's important to be aware of potential drug interactions when using Fragmin Syringe. This medication may interact with other drugs that have blood-thinning or antiplatelet effects, such as aspirin, clopidogrel, or warfarin. If your doctor prescribes these combinations, you will need closer monitoring to minimize the risk of bleeding. It's also crucial to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that can increase the risk of bleeding when used with Dalteparin. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Be sure to ask your doctor or pharmacist for more details. Remember to keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Fragmin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include excessive bleeding and bruising. It's important to seek help right away if you or someone you know may have taken too much Fragmin. It's important not to share Fragmin Syringe with others. Your doctor may also recommend lab or medical tests while using this medication, such as a complete blood count or anti-factor XA blood levels. It's important to keep all medical and lab appointments and consult your doctor for more details. If a dose of Fragmin Syringe is missed, it should be used as soon as remembered. If it is near the time for the next dose, the missed dose should be skipped. The next dose should be used at the regular time. Doubling the dose to catch up should be avoided. It's important to store Fragmin Syringe at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of the product, make sure to follow proper guidelines. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.